surgical specialties, be it neurosurgery, breast surgery, cancer surgery, or any other orthopedic surgery. Hip replacement is one operation which improves the quality of life of a person to the maximum. So it is one operation that is absolutely 95% guarantee that the person will be pain-free after the operation.
Wow, 95%.
It's an operation that over the last 40 to 50 years has stood the test of time and has been successful 90–95% of the time.
Now, we've heard about a procedure called resurfacing. Is that an alternative to hip replacement?
Let me explain to you what a hip normally looks like. This is a plastic model, and this is half a pelvis, and essentially that's your pelvis and that's the socket. And this is the thigh bone, or called the femur, and it has a shaft, a neck, and a head. And they come together and forms a hip joint. And this is the area which is all eroded and pitted, and so is the inside of the socket. And in order to do a total hip replacement, we have to do something to this and the head. In a traditional hip replacement, what we do is machine the socket and put an artificial socket. This artificial socket is made of a titanium, and it has beads on the surface, and once it is put in the patient, the bone of the patient grows onto it, and over a period of 6 to 3 months, this literally becomes a part of the patient's body. On the inside of the socket is the bearing material. This is the bearing on which the person really walks, and that traditionally is made of plastic. Now this is a very highly developed plastic called ultra high molecular weight polyethylene, and this really wears very, very little over a period of time. On the other hand, on the femur side or the thigh bone side, what we do is you take away the head and the neck of the femur, and then we put a pin down into the femur, and the purpose of this pin into the femur or the thigh bone is essentially to hold this ball, and that ball is the artificial ball which replaces the normal ball, and then this comes together, and this is how the patient moves. So the essential part is this bearing surface, which is a plastic and a metal.
Now, do they all use the same materials, or are there different types?
Partly, Stacy, yes. The socket, the shell of it is made of titanium, and that doesn't change depending upon what kind of hip replacement you use. But the inner surface, or the bearing surface as we call it, changes. Traditionally, you can have a very high developed quality plastic, but there are other options, and the other options are ceramic, which by nature is a glass material, and it is a very good bearing surface because it wears less than a plastic. But one of the potential downsides is that by nature is a glass material, hence it can crack or chip, and if one doesn't like that, then the other option is a metal surface. On the stem side, the pin itself is made of titanium, but you can change the ball, and traditionally the ball like this one is made of chromium cobalt, or you can have a ceramic ball, or you can have what is called an oxinium ball. What that is made of a metal called zirconium, and the surface of it is treated and oxidized in such a way that it has the properties of a ceramic, and essentially it has the advantage that it's still very hard and polished, and it wears less, but does not have the disadvantage of a ceramic that it can chip, so it doesn't break.
So clearly there are options when it comes to the materials, but are there also options when it comes to the actual procedure? Absolutely,
Stacey. And if a person is young and active, my choice of material is metal and metal. And we have a new type of replacement approved by the FDA in this country last year. It's called a Birmingham hip resurfacing. It is new in this country, but globally about 65,000 has been done, and we have data well over 9 years which shows that these functions very well in a patient who's young and active. Now, hip resurfacing is a different form of a hip replacement. Just to going back on a hip replacement has two parts: the socket and the ball. And in a hip resurfacing, the socket essentially remains the same. In a hip resurfacing, as you can see, this is the socket, or one half of the joint replacement. The inside of the socket, unlike a traditional hip replacement where it is made of plastic, this is a metal, a highly polished metal. On the outside, there are small beads, and the socket of the patient is machined, and this is press fitted into the socket, and then the bone of the patient grows onto it. But the difference from the traditional is now the bearing surface is fully metal. This is a very high, tough metal known as cobalt chrome with carbide, and the advantage is that it wears literally nothing. The other half of the hip replacement is this cap, or where in a traditional hip replacement, what we did was put a pin in the shaft of the thigh bone or the femur to put a head on top of it. Now in hip resurfacing, which is a more bone preserving procedure, we really don't have to remove the head and the neck, because arthritis, as you recall, is a disease of the cartilage, and there's nothing wrong with the bone. So why throw away the good bone of the patient? So now we preserve that, and we just machine the top of the ball, just like putting a crown on the teeth. And once we machine it, we cap it with a metal, and this has a very thin pin as compared to an old traditional pin, and the whole idea of this pin is just guides us where to put the cap in. And this is put on top of the femoral bone, and it is just held with a very thin layer of cement, and then the cap comes on top, and that becomes your newer hip replacement. Now, as you can see, one of the biggest advantage of this, that we are preserving almost all of the bone on the thigh bone side for future use, if this was to be redone in future. And one of the other big advantage of this is now, instead of metal and plastic, you have metal and metal. So that's the new bearing surface. So
why is metal on metal better for wear?
Because the wear of this over a period of time is extremely small. Just to give an idea, this wears, the amount of wear in this is equivalent to the size of a